Welcome to Rwanda Medical Academy. Today's lesson is about understanding hypothermia, prevention, recognition, and management. Introduction to hypothermia. Hypothermia is a medical emergency that occurs when the body loses heat faster than it can produce heat, causing a dangerously low body temperature. Normal body is around 98.6 degrees Fahrenheit, 37, and hypothermia sets in when the temperature drops below 95 degrees Fahrenheit, 35 degrees Celsius. It can be life-threatening and requires immediate action to prevent serious consequences or even death. Causes and risk factors. Several factors can lead to hypothermia, including exposure to cold weather or water, wearing inadequate or wet clothing in cold conditions, and inability to get out of cold conditions due to injury or other reasons. Certain people, such as the elderly, young children, and those with medical conditions that affect their ability to maintain body heat, are more at risk. Prevention strategies. Preventing hypothermia is key and involves wearing appropriate clothing, layer up with loose-fitting, lightweight clothes. Wool, silk, or polypropylene inner layers hold body heat better than cotton. Staying dry, wet clothing significantly increases the risk of hypothermia. Keep dry with waterproof gear. Keeping active, activity generates body heat. Keep moving to help stay warm. Monitoring weather conditions. Be aware of the weather forecast and prepare accordingly before going outdoors. Recognizing hypothermia. Recognizing the signs and symptoms of hypothermia is vital for timely intervention. Mild hypothermia, shivering, fast breathing, hunger, nausea, increased heart rate, and difficulty performing complex tasks. Moderate hypothermia, shivering stops, confusion, difficulty speaking, sleepiness, and lack of coordination. Severe hypothermia, shivering also stops at this stage, risk of unconsciousness, shallow breathing, weak pulse, and the body may feel stiff. Early symptoms include shivering, slurred speech, slow breathing, and fatigue. Management of hypothermia. Passive external rewarming. This method involves helping the body generate more heat. Remove any wet clothing from the affected individual and cover them with warm, dry blankets. Ensure they are in a sheltered environment away from further exposure to the cold. Active external rewarming. For more severe cases, apply external heat sources. This can include the use of warmed blankets, radiant heat lamps, or forced warm air. The goal is to warm the person without causing burns or discomfort. Active core rewarming. In cases of severe hypothermia, more invasive techniques may be needed. Warmed intravenous fluids, heated humidified oxygen, or heated peritoneal lavage are methods used to increase the core body temperature directly. Warm oral or intravenous fluids. Providing warm fluids can help gently raise the core temperature. This can be through warm, not hot, drinks for conscious individuals or intravenous warm fluids for those who are unconscious or unable to drink. Monitor vital signs. Continuously monitor the individual's vital signs, including temperature, heart rate, blood pressure, and oxygen saturation. This is critical to assess the effectiveness of the rewarming process and the patient's condition. Prevent ventricular fibrillation. Be cautious during the rewarming process. Rapid rewarming can cause ventricular fibrillation, especially in severe cases of hypothermia. It's crucial to warm the patient gradually. Conclusion. Understanding hypothermia, recognizing its signs early, and knowing how to effectively manage it can save lives. Whether you're a professional rescuer, outdoor enthusiast, or someone looking to broaden your knowledge, learning about hypothermia prevention, recognition, and management is essential. By being prepared and informed, you can make a difference in critical situations. Thank you for learning. Join and save a life with us at Rwanda Medical Academy.